Um, Statins are medications that many people recognize as a cholesterol lowering agent, but over the past decade, researchers have learned that they may also have beneficial effects and beyond the cholesterol, including effects on inflammation and fibrosis in the liver. And in fact, statins have been studied extensively chronic liver disease overall in conditions like viral hepatitis and the MASD, formerly known as fatty liver, and then even early stage of liver cirrhosis. Several large observational studies have suggested that statins may slow liver fibrosis, reduce complications related to portal hypertension, and even lower the risk of liver cancer sometimes. And about a year ago, our group also published a large scale study in JAMA Internal Medicine showing that statin use was associated with improved outcomes in patients with overall chronic liver disease, which further raised interest in their potential liver protective effects. Um, However, when it comes to primary liver biliary cholangitis (PBC), the evidence has been much more limited. And PBC, formerly known as primary biliary cirrhosis, is a kind of chronic inflammation and autoimmune conditions where the persistent inflammation is going on and gradually damages to small bile ducts in the liver, eventually leading to cirrhosis if left untreated. And unfortunately, most prior studies in the PBC focused on short-term lab changes such as cholesterol levels, then going down the liver enzymes, rather than the meaningful the long-term outcomes such as liver failure or transplantation requirement. As a result, we already did not know whether statins had any impact on the long-term course of disease. So the quick question that motivated our study was quite straightforward. Could statin actually improve important liver-related outcomes in real-world practice in patients with the primary biliary cholangitis? Because the PBC is a very rare disease, as you know, conducting a large randomized trial is very challenging. Sometimes they consider it impossible. So that gap in evidence is what led us to a target trial emulation approach and the long-term real-world data to address this question. Basically, we designed our study to closely mimic what a randomized clinical trial would look like in real life, even though we were using observational data. So this approach is called target trial emulation. And in simple terms, and it means we structure the data as if patients were being randomized at specific points in time based on their clinical status at that moment. So we use two large independent electronic health record database, one from Mass General Brigham in the USI and another from Asan Medical Center, Seoul in Korea, to make sure our findings were not specific to a single healthcare system. So instead of simply labeling patients as just statin users or non-users, we look at the statin initiation month by month. Each month, we identified patients who were studying statins and matched them to similar patients who were not. And based on, of course, based on their age, disease severity, and lab data or other medical conditions at the same time point. So basically, this design helps us to avoid common, drawbacks of pitfalls of observational studies, such as giving statins credit for additional survival time that actually occurred before the medication started, so-called immortal time bias or guaranteed time bias. So regarding this, most important finding from our study is we matched 443 statin users with 886 non-users and followed them for about 4 years. And what we found was quite simple and striking. Statin use was associated with a significantly lower risk of liver decompensation, about 40%, with a hazard ratio of 0.61. And we saw a similar reduction in a broader composite outcomes. that include liver failure, liver cancer, and liver transplantation. And interestingly, these findings were very consistent across both countries and database, and then even patients with and without cirrhosis, which says more confidence that our results, our findings are quite robust. And to me, the most important message from our study is statins were not only safe in patients with PBC, but they may actually protect against the serious liver complications in the long run.